middle-income countries, disruptions are predicted to cause 254,000 to 1,157,000 additional deaths of children under 5 and 12,000 to 57,000 more maternal deaths. 85% of HIV programs, 78% of tuberculosis programs, and 73% of malaria programs reported disruption to service delivery due to COVID-19. Increasingly, we see a two-track pandemic. As of 30 June 2021, 14.4% of vaccines have been administered in low and lower middle income countries, but they account for 46.7% of the world's population. The world needs to focus on equity and harness health-related data to reach those being left behind. 40% of all deaths worldwide are unregistered. This number rises to a staggering 90% unregistered deaths in the African regions. We now have solutions to precisely address such data gaps. In partnership with other multilateral partners and stakeholders, the World Health Organization is working with the member states to strengthen data and health information systems in countries. Data also drives the delivery and implementation of plans. The Sustainable Development Goals 3 Global Action Plan partners can collectively support countries to prioritize and track Sustainable Development Goals indicators and help identify and overcome bottlenecks to reach the 2030 targets. There is a light at the end of the tunnel. Countries and communities can get back on track to achieving the health-related sustainable development goals by using data to close equity gaps and advancing towards universal health coverage.
Well, that was a very compelling way to set the scene for our discussion today, showing so starkly the wider impacts of the pandemic, the imperative of filling these critical data gaps, and the challenges and opportunities ahead to solve them. Well, it is now my honor to give the floor to our esteemed host and the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, for opening remarks. Dr. Tedros, always a pleasure to see you, and the floor is yours.
Thank you, Elizabeth. Thank you, our moderator. Your Excellency, Minister Fawzia, Your Excellency, Minister Ahmed Al-Saidi, and Your Excellency, Dr. Mira, Minister Mira, and our moderator again, Elizabeth Cousins, President and CEO of the UN Foundation, Excellencies, distinguished guests, dear colleagues and friends. And also my greetings to my RDs, Hans and Ahmed, and my thanks to the government of Indonesia for co-sponsoring this very important meeting. Terima kasih. All of us here today recognize the profound damage that the COVID-19 pandemic has done to global development. Though the full scale of its impact has yet to be realized, it's clear that existing inequities and inequalities have been exacerbated. More people than ever are at risk, especially those living in countries affected by fragility, conflict, and violence. Our chances of achieving the Sustainable Development Goals seem more out of reach than ever before. Disruptions of essential health services have reversed years of progress in the control of communicable diseases, including measles, tuberculosis, HIV, and malaria, and has resulted in numerous preventable deaths. Mental health conditions and non-communicable disease prevention and treatment have also been badly affected. We are now in a particularly dangerous period of this pandemic. No country is out of the woods yet. While our priority is to respond to the current crisis, we must also prepare for the challenges of the future. The Global Action Plan for Healthy Lives and Well-being for All provides a platform to support countries in their efforts to make an equitable and resilient recovery towards the SDGs. We are stronger when we work together, and I'm proud of the progress WHO and our Global Action Plan partners have made to break down barriers, working across agencies and across sectors. As we gather today to focus our collective attention on recovery, there are 4 specific areas of collaboration I hope we can all get behind. First, supporting countries to build strong and equitable primary health care systems at the foundation of universal health coverage. Across the world, primary health care has been the first line of defense against COVID-19. Second, building resilience within and beyond health systems by addressing the underlying vulnerabilities that fuel crisis. Global health security starts with local health security. Third, better data to give a fuller understanding of what is and is not working, and using that data to strengthen the delivery of programs. Disaggregated data is also critical, both for identifying marginalized populations and for responding to systemic inequities. Finally, we need to scale up health sector innovations so that more countries can make use of them to save lives and improve people's health. Above all, the pandemic has taught us that health is not a luxury for those who can afford it, but rather a human right, a fundamental human right, and a prerequisite for social, economic, and political stability. Working together across the multilateral system, we can support countries to end the pandemic and, in due course, to make an equitable and resilient recovery towards healthy lives and well-being for all. I thank you. And Elizabeth, back to you. Thank you so much again.
Thank you so much, Dr. Tedros. And I think we all deeply appreciate the incredible balancing act of prioritizing all of the critical work to end and recover from this pandemic, while also not losing sight of all of the wider health goals, which of course underpin our ability not only to be healthy, but also to be resilient in the face of future pandemics and other threats, and very much always to heed your call that we are stronger when we work together. So thank you again. We'll now hear about the country-level experience from an esteemed group of ministers from their respective governments who will reflect on their experiences throughout the pandemic and their strategies for equitable and resilient recovery in the context of the SDGs. And I'm honored first to welcome Her Excellency Dr. Fawzia Abikar Noor, the Minister of Health of Somalia, who will speak to Somalia's challenges and how Somalia is prioritizing primary health care to accelerate progress toward universal health coverage and other health-related MDGs. Excellency, the floor is yours. I believe we have the minister.
Sorry. Thank you so much, Madam Moderator. Dear Director General of WHO, Dr. Tedros, dignitaries, excellencies, UNICEF representatives, and colleagues, a very good afternoon and a good evening to all of you. I'm happy to be with you all in this event and share our country example. As many of you would know, in Somalia, we are facing a monumental task in rebuilding our health systems, which was weakened and fragmented by years of instability, fragmentation, and lack of investment. As a result, the last 2 decades and a half has seen mass migration of our skilled health professionals, creating a huge loss of human capital. Today, there is less than 1 doctor, nurse, midwife per 1,000 people in Somalia. Although our health training institutions are producing different types of health workforce, we estimate that at the current rate of production, it will take us more than 2 decades to reach the minimum health workforce density of 2.5 per 10,000 populations. This means that our march towards universal health coverage might be at risk. Our high maternal, infant, and child deaths and the low immunization coverage reflect, among others, the inadequate access to essential healthcare services and other social and economic opportunities. The decades of conflict and violence have also led to recognized marginalization and social exclusion of our young people who comprise 70% of our population, as well as other vulnerable people such as women and children and the internally displaced persons. These are the drivers of poverty and resultant health inequity in our country. As the COVID-19 outbreak revolved in Somalia, several events also unfolded. COVID-19 pandemic has further strained our fragile health system, and this has negatively impacted the delivery of the essential healthcare services. As a fallout, we might see a lot of our modest health gains being pushed back or reversed. The life-saving vaccination coverage, which is already very low, may drop by 20%. Facility-based delivery may decrease by 4%, and childhood mortality can increase by 13%. The economic downturn of this pandemic on a country recovering from this crisis can equally be catastrophic, leading to a negative impact on health. The World Health Organization's Pulse survey on continuity of essential health services during the COVID-19 pandemic, to which Somalia participated, showed that during May-September 2020, 33% of essential health services were disrupted, 1 out of 3 services, while during January to March 2021, there is continued disruption of 12% of essential health services. That means 6 out of 51 services, signifying that substantial disruptions persist even after 1 year of the pandemic. Almost the 6 major essential health services where significant and persistent disruptions have been reported include reproductive, maternal, newborn, child and adolescent health and nutrition services, immunization services for children, and primary health care services. The big question is, can we turn the current situation to opportunities? The health sector in Somalia has embarked on the implementation of a transformative agenda aimed at rebuilding and recognizing its health system to achieve universal health coverage using primary health care services as the entry point. While we need this transformation as we recover from the pandemic, let me state some facts. Any child who is born today in this country is about 16.5 times more likely to die before the age of 5 than any other child elsewhere. The lifetime risk of maternal death in Somalia is 1 in 22, higher than most countries. Instead of having a status quo, we are now changing this narrative with support from our multilateral partners and international development agencies. Through a wide-ranging consultation with our partners, we have now developed an essential package of health services with an integrated service delivery model with primary health care at its heart. The package recommends a set of cost-effective and evidence-informed interventions to be delivered across all service platforms in the country. This package will take the services close to the families, ensure continuum of care across all service delivery platforms, and improve access and coverage. We are hoping that if these services can be rolled out at a scale, it will address disparities and health inequities which we often see between urban, rural, and nomadic populations, and also within population groups. By decentralizing and devolving power to district level for delivering these services, we are also creating the fundamental platform to build strong health systems at the district level. The package will cost US dollars 11.5 to 15 per person per year, and we will need 184 to 240 million US dollars a year to roll it at a scale. Approximately 80% of this cost will be consumed at the primary health care level, which is the bedrock to achieving universal health care. We have modeled the impact of this investment. Let me talk about two biggest health gains here. The maternal mortality ratio is expected to decline to about 50% at its current rate by 2030. The neonatal, infant, and under 5 mortality rates are expected to decline between 20 to 35% by the year 2030. There will be additional benefits like increased child survival rates, improved population productivity, and improved life expectancy, among others. We are optimizing both primary and hospital-based care for achieving universal health coverage. It's also our vision that the implementation of essential package of health services will lay the foundation for a resilient health system in Somalia that can prevent, detect, and respond to disease outbreaks and improve health security. Finally, let me conclude by saying that supporting health systems in fragile states is clearly a global public health good. Either we align our actions or ignore at our own risk. It will be harder to make further progress on global goals and our aspiration to achieve universal health coverage by 2030 for all countries if we do not support the fragile, conflict-affected, and vulnerable countries to improve primary health care and achieve universal health coverage. Our health systems can be as strong as our weakest links. Therefore, more than ever, we need to value having a strong, collaborative, and cohesive multilateral partnership that supports the governments of fragile countries to improve their health systems. We should support, promote, and accelerate investment on community-based care as well as on secondary level care as part of healthcare continuum with a functional referral pathways. We believe that time has come to evaluate the results of the verticalization of disease-specific control programs in countries with fragile health systems, particularly its contribution in building resilient health systems, which, as we all know, is an essential prerequisite for the success of any health program. I should point out that if the current level of funding, both from domestic and external sources, does not drastically improve, many countries in the developing world, and indeed Somalia, will not be on track of meeting the health-related indicators of Sustainable Development Goals. The global ambition to accelerate progress on UHC service coverage are increasingly unlikely unless concerted actions are taken and countries can better translate health spending into improved performance. Crisis can unlock opportunities. It's possible to advance both health and development if done properly. We must also remember that in this interconnected world, good health in fragile states are indispensable for global health security. I will end by saying to all that unless we win our fight against inequality and inequity in health systems anywhere in the world, and unless we commit ourselves to build functional health systems in fragile and vulnerable states, we will not be able to achieve victory and meet the global health goals. I thank you all for your time and giving me the opportunity to speak about my country. Shukran.
Thank you so much, Minister Noor, for such a powerful start to this segment, and especially your highlighting the risk of reversal of hard-won gains, the imperative of primary health care, and of course the special circumstances of countries in conditions of fragility and the need to pay attention in additional and innovative ways. So I want to thank you very much for starting us off so compellingly. We'll now turn to the Deputy Minister of Health and Social Protection of Albania, Dr. Mira Rakacholi, if I'm pronouncing your name correctly. Welcome, Deputy Minister. We're thrilled that you're here and look forward to hearing from you about Albania's recent assessment of progress towards the health-related SDGs, and especially what role you would like to see the Global Action Plan play moving forward. So please, Deputy Minister, you have the floor.
Thank you, Madam Moderator, for giving me the floor. Honorable General Director of WHO, Dr. Tedros, my very distinguished counterparts from civil regions and countries of the world, Excellencies, participants and representatives of civil society, let me start by thanking Germany and Indonesia for organizing such a timely event at the margins of High-Level Political Forum 2021. This year, this forum finds the global community still fighting against the COVID-19 pandemic and facing the multiple challenges that this scourge has caused worldwide. Its consequences are still increasing, despite the governmental and multilateral responses. Even though before the pandemic, the world was committing to the 2030 Agenda for Sustainable Development Goals to fight inequalities and guarantee social cohesion for all, unfortunately, the pandemic affected what was described in the objective of the achievements of SDGs as a world of universal respect for human rights and human dignity, rule of law, justice, equality, and non-discrimination. Although the development of safe and effective vaccines has made considerable progress in addressing the pandemic, the social cohesion of our societies and communities has been globally challenged. The multifaceted complexity of a global health crisis reminds us of the paramount importance of equally focusing on the implementation of all the SDGs in order to ensure healthy lives and well-being at all ages. One of the lessons learned from this pandemic is that guaranteeing resilience goes together with reinforcing our healthcare systems not only through medical supplies and new technologies, but also through investing more in human capital. Rapid response to the crisis needs a comprehensive socio-economic vision, strengthening public-private partnerships, and focusing on the most vulnerable groups, as well as on youth and next generation. Excellencies, while the Albanian government, in cooperation with all the stakeholders and civil society, were on the right track on the efforts towards the implementation of the targets of SDG 3 on the good health and well-being, the country got impacted by the COVID-19 pandemic, while still was recovering from the consequences of November 2019 severe earthquake, which triggered substantial suffering and human loss. The strategic and immediate response to the earthquake experience itself, also led to the revision and redevelopment of Albania's emergency preparedness and readiness plans, eventually facilitating a timely response to the COVID-19 challenges through public health safety measures and response and recovery strategies. The COVID-19 crisis further highlighted the importance of primary health care as a nexus to simultaneously ensure progress towards universal health coverage, strengthening health security and improving health and well-being. The cross-country exchange of experience continues to facilitate further learning, providing opportunities for building regional synergies and prioritizing actions for further improvement of health systems and acceleration reform. The crisis also provided an opportunity to develop integrated system of social and health services at community level. From our national experience, we can say that linking health services with social services will allow easier access to multidisciplinary patient-centered services. This is something that we have defined in the Albania strategy for the development of primary healthcare services 2020-2025. Distinguished participants, Already prior to the pandemic, Albania had politically prioritized the implementation of the Global Action Plan for Healthy Lives and Well-being for All, which translated into thorough analysis of Albania's status on health and well-being. When analyzing the Progress Report 2021 and its findings, which they identified bottlenecks and challenges impeding Albania's progress towards the implementation of SDG 3, we reaffirmed that need to further improve mainstreaming and localization of the 2013 agenda across the whole of society. Harmonization and integration of the SDGs into the government and non-governmental policies and strategies will be essential to ensure policy coherence across sectors. We need increased engagement across sectors, beyond the health sector, when developing and implementing legislation and policies, and stronger civil society involvement to ensure that policies are aligned with community needs. Further efforts are also required to expand the evaluation process to be able to monitor progress of health and health-related indicators and to support evidence-informed policies and decision-making. Financing for health will have to increase gradually to overcome some still existing financial barriers to accessing health care. Health system reorganization needs to continue with gradual decentralization and accountability at local level. Health workforce and human resources for health will remain a priority, and further innovative approach and incentives will be crucial to retain highly qualified professionals. To harmonize health-related data, we need to work towards a single integrated health information system, and we need a strong evidence-based and common standards of care. Innovative approaches towards increased social protection are now in the process of being implemented and also supported by joint SDG funding through UN agencies. A framework and models of integrated social and healthcare services is developed. Improved social protection coverage is rolled out, covering 6 pilot municipalities. More than 700 vulnerable households have benefited from the integrated health and social protection services. We are addressing the multidimensional impact of COVID-19 through small grants projects with NGOs, social mobilization campaigns, emergency support to households, and humanitarian cash transfers payments. And we are working on options to create fiscal space to expand the social protection coverage and benefits for the most vulnerable to leave no one behind. We are finalizing Albania's National Health Strategy 2021-2030 and the National Strategy for Development and Integration 2021-2030. We need to integrate a number of strategic focus areas, prioritizing strengthening of primary health care and integrated social services, sustainable financing for health, prioritize data and digital health, and consolidate efforts to reduce inequality and disparities. Dear colleagues, as of January 2022, Albania will have a seat in the United Nations Security Council for the next biennium. The last 2 years have been of paramount importance for exposing the volatile but also the strengths of human security. In this regard, I would like to highlight the need in combating and sustainably recovering from the COVID-19 pandemic through greater national, regional, and international cooperation and solidarity, and a coordinated, inclusive, comprehensive, and global international response with the United Nations playing a key role. To this end, let me conclude by emphasizing that 2030 Agenda provides a common framework for our collective efforts to respond and recover from the COVID-19 pandemic. This is why we remain committed to its implementation, to build forward better, and to ensure Albania's contribution towards achieving the global SDG goals. Thank you for your attention.
Thank you, Deputy Minister Mira, for these insights and considerations, especially about the many ways you described for engaging partners across sectors in a whole of society approach. And again, this emphasis on data, on health information systems, etc. Thank you so much. I now want to turn to His Excellency Dr. Ahmed Mohammed Al Saidi, the Minister of Health of Oman, who will reflect on the impact of conflict on countries' abilities to achieve health-related SDGs, and how health has the potential also to accelerate progress on other SDGs, including through initiatives like Health as a Bridge for Peace. Please, Mr. Minister, the floor is yours.
Thank you very much. Your Excellencies, dear brother Dr. Tedros, ladies and gentlemen, colleagues, good morning, good evening, and good afternoon. It's an honor to speak at this very important meeting and to be part of this distinguished group of speakers. I would like to thank the WHO and the co-sponsors for organizing this event. Even before the COVID-19 pandemic, many countries were off track in achieving the health-related SDGs, with a high prevalence of malnutrition, stunning in children, gaps in sanitation infrastructure, and educational inequalities. The lag was further exacerbated in conflict-affected states, which face the greatest challenges. Our region, the Eastern Mediterranean, is significantly affected by conflicts, and disparities among countries are evident. These challenges will prevent us from meeting our goals globally if we do not address them. Leaving no one behind necessitates clear identification of needs and gaps to be addressed effectively. Although we are yet to understand the full impact of this pandemic on the world, COVID-19 has significantly strained all countries' coping capacities, especially those countries deeply reliant on foreign aids, as evidenced by the inequality in access to vaccines and other essential healthcare products. Dear colleagues, the SDGs represent a roadmap for a better future that inspire action and cooperation among diverse actors and agents of changes, while simultaneously offering flexibilities in adjusting pathways based on countries' context. Health is central to this roadmap because it is an important tool for building sustainable and equitable systems. Health can play a role in promoting peace, encouraging dialogue across parties, and advocating to cease hostilities to deliver healthcare for civilians. After all, health does not recognize borders, and the health of one is the health of all. This is why we in Oman are consolidating the Global Health for Peace initiative, which was inspired by WHO's Health as a Bridge for Peace framework. Oman and Switzerland had launched this initiative in 2019, initially focusing on using health to promote dialogue and multilateralism in the Eastern Mediterranean region. However, with the growing interregional interest, we have expanded the initiative globally. Ladies and gentlemen, the implementation of the 2030 Agenda requires an effective approach that emphasizes integration of all goals and targets. To achieve sustainable development, we cannot implement each SDG in isolation. Rather, we need to encourage synergy between all 17 goals. We can translate this synergy into our policies and practices through closely aligning goals and targets. Health and well-being can be an entry point for this integration. While it may be the focus of SDG 3, it is also a major cross-cutting theme of all SDGs, which can be used to get us back on track to coordinating work across policy areas. Bringing together health and non-health sector is critical for joint effort in addressing the social determinants of health, which relates to different SDGs. It is particularly relevant to SDG 10, reducing inequalities and disparities, as it will ensure equitable access to essential services, universal health coverage, and to financial protection. Addressing SDG 16 by promoting peace, justice, and stronger institutions will have positive impact on the health and well-being of individuals, leading to more prosperous and productive populations. Action on health, peace, and equity through a common approach requires advocacy across all levels, from communities to frontline workers to policymakers. Addressing both goals through a health-focused lens will contribute towards the sustainable safety and security of populations and ensure that no one is left behind. Ladies and gentlemen, dear colleagues, multilateralism is the best response to our new reality. To reach our targets, we must ensure global coordination and solidarity. And most importantly, we need to uphold the role of WHO as the global coordinator to such efforts through more sustainable funding and reform to enhance its efficiency. Thank you.
Thank you, Minister Al-Saidi, especially for highlighting the distinct challenges of conflict-affected states, the peace health linkages, and your final call for multilateralism as the best response to our new reality. I think that's a message that we all carry every day in our work and really value your putting on the table at the start of this session. And a warm thanks again to all of our distinguished panelists for such candid remarks and a powerful way to ground the rest of our discussion. All of the reflections we've heard offer a very rich segue to our panel, which features WHO regional directors and leaders from key WHO partners in health. And I'll introduce them all now before we give them the floor. So joining us this afternoon are Dr. Ahmed Al-Mandari, Regional Director for the Eastern Mediterranean, Dr. Hans Kluge, Regional Director for Europe, and we'll hear video remarks from Dr. Poonam Singh, who is Regional Director for Southeast Asia, for WHO, all of them. We're also thrilled, of course, to have on the panel Dr. Anuradha Gupta, Deputy CEO of Gavi, Birgit Ebsen, Regional Director for Europe for the IFRC, Lakshmi Balaji, Head of Health System Strengthening at UNICEF, and finally, Dr. Justin Kunin, who wins the award for getting up in the middle of the night to join this panel, the President of ACON and Co-Chair of UHC 2030, joining us from Australia. We're honored and delighted to have all of you with us today, so thank you again. And we'll start with an initial intervention from each of our panelists, and I ask that you try to keep yourselves to about 3 minutes, and then we'll open up the floor for it with as much time as we have remaining. But we'd like to hear from each of you on your reactions to what you've just heard from Dr. Tedros and from the ministers. How can the multilateral system, including through the SDG 3 Global Action Plan, best support countries both in their response to COVID and more widely in their plans to meet health-related SDGs? And I want to start first with the WHO regional directors. And Dr. Al-Mandari, I want to start with you. Please, you have the floor.
Thank you very much, Elizabeth. Thank you for giving us the chance to join you in this important discussion and meeting. And I would like us to thank their excellencies for their key input on the acceleration solutions for an equitable and resilient recovery. And as rightfully said by them as well, health is relevant across all SDGs and is central to achieve sustainable development. I would like to touch upon this important issue from a regional perspective, in which we strive towards a universal health coverage and attaining the health-related SDGs. But as you all know, we are really challenged with emergencies and conflicts, which is a context in several countries in the region. As it is Dr. Saidi mentioned, 2/3 of our countries and territories of the Eastern Mediterranean region are a state of moderate to high-level emergencies. The situation in several of these countries has been significantly deteriorating, as you all see in the news, and as you have observed, like, for example, in Afghanistan, in Libya, in Syria, as well as the occupied Palestinian territory. That adds to the situation of the long-standing complex humanitarian crisis, as witnessed in some countries in the region here, like, for example, Yemen and Somalia, as have been mentioned by Her Excellency Dr. Fawzia. This situation has been compounded by the fact or the effect of COVID-19, which has challenged the health systems across the globe. Wealthy, well-stable, well-established systems, as well as systems suffering from a lot of shortages and at fragile situations. The pandemic has directly and indirectly affected the population lives and their well-being regardless of their socio-economic situation. Within the pandemic response, as have been mentioned by their excellencies, essential services such as immunization, for example, child and women health have been disrupted by all means. And there are indications that progress in the SDGs have been pushed back substantially. As a result, countries in emergencies, along with others, are off track, I have to say, to achieve all health-related SDGs, with labs towards attaining the universal health coverage goal. So this is another emergency that we need to face. Here comes the importance of multilateralism, which plays an important role to create solidarity, followed by action to help and support. Alignment of the 13 UN partners to achieve the Global Action Plan for Healthy Lives and Well-being for All, as Dr. Tedros mentioned, does provide the impetus to fulfill the pledges to attain the SDGs on health-related topics. Now, on the regional level, the Regional Health Alliance that have been created 2 years back offers a venue for coordinated work to address the SDGs along with our regional vision 2023 Health for All by All. Implementation of the GAP agenda in our region has been mounting with several joint activities being implemented. I am really pleased to see that, in front of my eyes, and I'm sure countries are really feeling. We put much emphasis on strengthening health diplomacy and effective multilateral discussions in WHO governing bodies, leading to better engagement and joint decision-making among regional member states. The pandemic has shown how central health is for sustainable development. And health is relevant, as I said, across all SDGs. Now, when it comes into COVID, it has deepened the existing inequalities, as Her Excellency mentioned, including gender inequality. The call for solidarity, enhancing access to services, in addition to ensuring equitable distribution of COVID-19 vaccines, will surely contribute to reducing inequalities within and between the countries, which is fulfilling the expectation of the SDG number 10. Of equal importance is the promotion of peaceful and inclusive societies, as His Excellency Dr. Saidi mentioned, which will lead to healthier populations and prosperous communities. And this is in confirmation of the linkage between the population's health and well-being on one side and peace and justice with stronger institutions on the other side, which is the essence of the SDG number 16. In our region, we have embarked on a process to promote confidence building through a health and development platform. The Health for Peace initiative, which is by Dr. Saidi, promotes action in the use of health as a brick for peace in those areas affected by conflict, and he is supported by Switzerland and many other countries. And it builds on WHO's role as a neutral actor to foster collaboration with all stakeholders to promote diplomacy. Several activities have been undertaken since we established that initiative. The report of the EMR Commission on Social Determinants of Health highlighted as well the need to provide humanitarian response that address inequities, which may produce future conflicts, as it is happening in some countries. Now, we have developed a key part to risk and evidence on health and peace, as the Lancet Side Commission titled Peaceful Societies Through Health and Gender Equity. The Commission is developing case studies for conflict-affected countries in the region to bring lessons learned to countries in the region and beyond. And here I'd like just to conclude, and I'm sorry if I took this much time. Health is a driver for peace, and peace is a condition for health. It is very strongly linked. We cannot separate them, and we have to have both of them in order to make sure that we are really heading towards SDGs and fulfilling the expectations of SDGs. We are convinced that our joint work for universal health coverage and sustainable development using multi approach will be our bridge to humanity, will be our bridge to development in health. That's all from my side. I'm sorry if I took this much time. It is my great pleasure and honor to be with you. Thank you very much.
Thank you so much. And I'm hard pressed as a moderator to cut anyone off because these are all such rich interventions. So thank you very much. Dr. Kluge, the floor is yours next. But before you take the floor, I just want to remind colleagues listening, if you have any questions that you want to ask when we get to the interactive portion, please do enter those in the QA function of Zoom so that we'll make sure that we can account for those in good order. Dr. Kluge, please, the floor is yours.
Thank you very much, Elizabeth. Dear Dr. Tedros, Excellencies, Madam Deputy Minister, Mara Kalkori from Albania, my brother Ahmed, well present.
Dr. Kluge, I'm going to interrupt you. We are having some audio difficulties with you. I think everybody's experiencing me. If I might, we had this happen with a colleague earlier and they had to disconnect and reconnect. I might suggest you do that, and I will, if it's possible, we can cue the video from Dr. Singh while you're sorting that out, if that works for our WHO colleagues. Why don't we do that, and then we'll make sure we've got you sorted. Sorry to interrupt, but we want to make sure we hear you. We have a video contribution from Dr. Singh, so perhaps we can cue that up.
WHO Director General Dr. Tedros, Ms. Elizabeth Cousins, President and CEO of UN Foundation, Excellencies, UN partner representatives, regional directors, my special thanks to the co-sponsors of this event, Indonesia and Germany. The COVID-19 pandemic has had vast and devastating impact on progress towards Sustainable Development Goal 3 and the wider 2030 agenda. First, in its direct impact on health. Second, in its indirect impact on health. And third, in its impact on the social and economic determinants of health. The World Bank estimates that more than 120 million people globally have been pushed into extreme poverty, 60% of them in South Asia, and that is before the second wave. The crisis is immense, but it need not be multi-generational. Primary health care is the only way forward, a point rightly underscored in the SDG 3 GAP's new thematic challenge and consistent with the region's flagship priority on achieving universal health coverage. PHC services are where most people's health needs should be met throughout the life course. When people cannot easily access PHC services that are affordable and are of adequate quality, health and development suffers. When they can, it greatly improves, driving progress on all development indicators, leaving no one behind. The multilateral system and its partners have a range of opportunities to deliver high-impact, sustainable support, not only to promote commitment, but also accountability, precisely what this high-level forum aims to achieve. Throughout the COVID-19 response, WHO has been urging all countries in the Southeast Asia region to sustain and scale up health spending and to allocate an additional 1% of GDP to PHC services specifically. Despite intense fiscal pressures, all countries in the region remain committed to achieving UHC and also enhancing emergency risk management, another of our flagship priorities. Yesterday, WHO and its member states in the region embarked on a rigorous 2-day conference on strengthening health information systems with a focus on increasing country capacity to collect, analyze, and apply high-quality disaggregated data. Achieving our objective is essential for countries to identify and correct existing inequities, whether based on income, age, gender, or any other stratifier. And it will require adequate and ongoing technical, operational, and financial support from partners in the region and beyond. In a range of key areas, not least of them health financing and debt relief, multilateral action and engagement is required to drive high-impact solutions that not only strengthen the COVID-19 response, but which make long-term progress possible, including by reducing fragmentation and inefficiencies. Last year's joint WHO-ADB meeting with finance and health ministers from across Asia and the Pacific is an excellent example of how multilateral action can empower leaders from across sectors and regions based on shared experiences and lessons learned. Innovative action is likewise needed to solve chronic and under-addressed issues that weaken PHC services in low and middle-income countries, such as inequitable and unethical models of health workforce mobility. I commend the tremendous efforts of all involved in last month's tri-regional policy dialogue, which catalyzed renewed multilateral progress in this crucial area of work. At this historic juncture, we must harness the full power of multilateralism to empower communities, strengthen partnerships, and deliver a PHC-led recovery that is healthier, more equitable, and resilient, and which achieves the SDG targets. I once again thank Indonesia and Germany for co-sponsoring this event and wish you all success in your deliberations.
Well, thank you to Dr. Singh in absentia, and wonderful to hear those remarks. I think we have Dr. Kluge now back online, so we're going to try again. Dr. Kluge.
Thank you, Elizabeth. Do you hear me fine?
We do. You're loud and clear. Wonderful.
Okay, that's wonderful. That's wonderful. I have addressed already everyone, so right for the time, kindly allow me to jump straight into the speech and give a number of pointers to answer this very important question. So in the WHO European region, we conducted 7 country gap baseline assessments in which we identified together with the countries the key priorities within the SDGs, which then informed their national development plans. Number 1. Number 2, with the partners, we upgraded what we call the issue-based coalition for health with all our UN partners, so to synergize and multiply the output by working together at the country level as a one UN to support our member states. Then in September 2020, the 53 member states of the WHO European region adopted the so-called European Program of Work. Globally, there is the GPW, and we developed the EPW, which starts from the political premise: what do the citizens legitimately expect from their health authorities? And what we're doing now, that's a new modus operandi, is to work more sub-regional, because we have 53 member states in the region, very diverse, all kinds of incomes. It's to sub-regionalize the European Program of Work, like we just did for the Western Balkans, and we launched it at the Head of State Summit of the Western Balkans yesterday, chaired by Madame Angela Merkel. We are now doing the same for the 11 so-called small countries in the region. Further, as a staunch advocate for a renewed multilateralism through enhanced international cooperation and global solidarity, I personally convened an independent pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, and policy meaning far beyond a pre-pandemic definition of health. It is chaired by Professor Mario Monti, previous Prime Minister of Italy and European Commissioner, and there is a specific set of recommendations on multilateralism, international governance, which we are going to discuss tomorrow morning with the Prime Minister of Italy, Mr. Draghi, as the presidency of the G20. It includes, for example, to establish a global health board, which is modeled on the Financial Stability Board after the economic crisis. And another one is the Pan-European Health Threat Council, because in our region, we don't have really a platform, a multilateral platform, where countries can come together. And we see, for example, a very concrete initiative now, which was discussed by the Deputy Prime Minister of Belgium this morning when I met him, on the COVID-19 certificates. So in the EU, you have a certain COVID certificate. They accept some vaccines which are approved by the European Medicines Agency. But what about all the other countries, including also the other regions? So we need much more policy coherence. And the Russian Federation, for example, among others, have already expressed some support for such a Pan-European Health Threat Council. Finally, that's some experience from my side. What I saw is one of the political determinants of the pandemic is that this is a stress test in Europe, and maybe beyond Europe, for public-private partnership. So I'm trying also to bring in both the industry and the multilaterals to act together in order to leave no one behind. Because we shouldn't forget that there are about hundreds of contractual arrangements by the pharmaceutical industry previously competing who work together to develop a vaccine in no time. So I think this is really the time to work together with a common goal. Thank you for this wonderful opportunity.
Thank you so much, Dr. Kluge, and a pleasure to hear you. So wonderful. We want to go now to our further panelists, WHO's key partners in their work to promote health and well-being for all. I want to turn first to Birgit Ebsen from the IFRC. Birgit? I believe we have you online. I saw you earlier.
I'm absolutely here. Thank you so much. And thank you for the invitation. I feel like saying that when listening to all of you, the distinguished ministers and the colleagues, thank you so much for giving us the opportunity to be here. Talking about multilateralism and talking about private sector partnerships and the complementarity, I just feel like saying together, I'm sure that we can do much more. There are so many partners, so many mechanisms, and if we join in our activities, there is a lot of opportunity. From the Red Cross and Red Crescent, from the Red Cross and Red Crescent staff and our 14 million volunteers, of whom many are working on the front lines, we are painfully aware how already vulnerable communities are disproportionately affected and made even more vulnerable by the pandemic itself, as well as to its secondary impacts. COVID-19 has for us highlighted that pandemics do not discriminate, but that inequality affects how exposed individuals and communities are to the impacts of these crises. The Red Cross and Crescent Network prioritizes health equity within the framework of the universal health coverage concept, focusing especially on hard-to-reach populations. Here I'm thinking about people on the move, people with HIV, with tuberculosis, older people, and people with disabilities. In the Europe that, like the WHO, is a very diverse size, covering more or less the same region as Dr. Kluge just explained, we are providing life-saving services to migrants in Turkey, where we have our absolutely biggest program, in the Balkans, in Greece, Italy, supporting IDPs in Ukraine, in Armenia and Azerbaijan, working with displaced people and economic migrants in Russia and Belarus, and we support health systems to eliminate tuberculosis. And we also seek to influence the health legislation to eliminate the stigma and discrimination for people with HIV in Belarus, in Kyrgyzstan and Tajikistan. Thus, Equitable access to health services, including vaccines in these times, especially in times of COVID-19, is not only common sense, but it is a very significant way to reduce inequalities and to achieve progress towards the 2030 agenda. Please allow me to share 4 recommendations from here in support of the implementation of the universal health coverage and with a focus on the interconnected SDGs and vaccine equity. Traditionally marginalized groups such as undocumented migrants and refugees must be given equitable and effective access to health services, including the COVID-19 vaccines. The pandemic is pushing about 120 million people around the world into extreme poverty this year, as we have already heard. This is according to the World Bank. Overcoming these setbacks will require historically excluded groups in national COVID-19 vaccine rollout, but it will also ensure that economies can reopen and that individuals can return to work without fear of contracting the virus. An inclusive vaccine rollout will mitigate the deepening of income inequality. It will reduce hunger and enable education opportunities. Secondly, we need to continue to act in support of the people in the most vulnerable situations by ensuring fair allocation and timely delivery of vaccines. Prioritizing equity means putting those often left behind at the center of our collective response. And to understand and address these context-specific barriers and opportunities to meet the need of the hard-to-reach communities, we must work with local organizations and community entities. Redistributing power to local organizations and communities will reduce inequalities, build trust in institutions, and promote gender equality. And as we are now here sitting considering the connections between the SDG 3 for health and the SDG 16 for peace and justice and strong institutions, we know from our long experience working with communities that trust must be earned. When people don't trust, they refuse to use effective biomedical tools and services available to them, such as the COVID-19 vaccines. And I believe that to build strong and peaceful institutions, we need not only to explore new innovative ways of financing access to quality healthcare, but we also indeed need to involve communities in co-designing solutions from start to end. This is how solutions become relevant and meaningful for the users. And this, as was also pointed out by Dr. Tedros, requires a culture of data and accountability in our community engagement and response efforts. The IFRC, UNICEF, and WHO Collective Service for Risk Communication and Community Engagement is a critical tool that can help propel such health equity. Final recommendation is addressing local vulnerabilities through empowered, locally led response will promote progress across the SDGs. Local organizations, including our Red Cross and Crescent Society, can leverage community engagement on routine and campaign immunizations and enhance people-centered design for context appropriateness and equity to prepare communities to the rollout of the immunization efforts, and to prioritize the underserved communities and make sure that we put the last mile first. We are grateful for this important event and are resolute in collaboration towards implementing an inclusive, community-led UHC agenda, centering equity and humanity at the core of the 2030 agenda. Thank you so much.
Thank you so much, Ms. Ebsen. It's wonderful to hear from you. And I want to turn next to Dr. Lakshmi Balaji from UNICEF. Dr. Balaji, your thoughts.
Excellencies, Director General Tedros, and friends from the UN system. Colleagues before me have already outlined what it means in the COVID times to be a child and a mother. They are indeed amongst the worst affected and the most vulnerable The film earlier in the opening did show about the additional burden in terms of the mortality, under 5 mortality of over 1 million just during the COVID. So COVID, in addition to its own effect, brings a second pandemic for women and children. This is the time when UNICEF, together with our GAP partners, through the various accelerators, are contributing to helping countries do evidence-based analysis, engage and accelerate their programs aimed at primary health care for the most vulnerable. Whether it is through the fragile and conflict and violence-prone countries, or through R&D and innovation and access, as was done in Somalia to bring oxygen to concentrators to the worst off, or through data and digital health, we try and support countries to address the most vulnerable. One area, one simple example for that evidence dimension, zero-dose communities, that is communities with 0 dose of immunization given so far, is a good example or a good marker to identify the most vulnerable communities which receive immediate attention. We have noticed that in a number of country interventions, it is about digital health. But are we in some ways making a divide between those who have access to digital health and those who do not? Are the kind of issues that we need to take into cognizance to make sure that the most vulnerable and the marginalized are having access. I do not want to go into details around the COVID vaccine access itself, about which many speakers have already outlined. We want to make sure that the vaccine is available to the most vulnerable and the frontline workers. The COVID pandemic has clearly demonstrated that primary health care is at the core of a resilient health system that can meet the challenges. Investing in primary health care, investing on primary health care package of services that addresses the worst off segments of the population, and is also a greater attention to the community health workforce at the primary health centers and the primary health care is a priority that through the GAP and the primary health care accelerators, UNICEF and WHO are supporting countries. Another area that is very clearly evident is the multi-sectoral nature of the issues. WASH, nutrition, ICT, education, all of these sectors need to keep up in order to be able to deliver health. Health, it is clearly recognized, is not just a social sector, is emerging as the economic engine that needs to be energized, and therefore investing in human capital through health is an important way to get countries back on economic recovery. Thank you very much once again, moderator, and I look forward to continuing to support through UNICEF our countries to lead on primary health care. Thank you.
Thank you, Dr. Balaji. I want to turn the floor next to Anuradha Gupta, the Deputy CEO of Gavi. It's wonderful to have you with us, and please, over to you.
Thank you. It is such a pleasure to share thoughts at this very important event, and so much has already been said. But let me just begin by saying that in the wake of COVID-19 pandemic, we have indeed seen unprecedented multilateral collaboration. Development partners, governments, UN agencies, other stakeholders have stepped up significantly in supporting countries in maintaining essential services, recovery from COVID-19 disruptions, but also trying to advance this whole new goal of rapid and equitable access to COVID-19 vaccines. But certainly, as has been said by several previous speakers, there is more that we can do together. And we really feel that it is equity that has to be the unifier for all multilateral institutions and community as we see the pandemic pushing millions more to the brink. As has been said, we know that for the first time there is now a very serious risk of a reversal of hard-won gains. Even before the pandemic, more than 10 million children born every year in Gavi-supported countries did not receive a single vaccine shot. And these zero-dose children accounted for 50% of vaccine preventable deaths, really showing the disproportionate burden of mortality and morbidity that is concentrated in these children and the communities that they represent. 2/3 of these zero-dose children live in households that survive on less than $1.90 per day, which is the international poverty line. And therefore, these zero-dose children, in fact, embody communities that face compounded vulnerabilities, not just poverty, but also gender barriers, stigmatization, low access to education, nutrition, sanitation, water, hygiene. And as the pandemic further deepens inequities, the number of zero-dose children, we have to realize, is bound to rise further, leading to an increase in child deaths, disease outbreaks, and medical impoverishment. So any COVID-19 response or recovery effort will be incomplete if the multilateral institutions, along with countries, fail to put the needs of these communities at the heart of all these efforts. We also feel that for all this to happen, multi-agency, multi-sectoral coalitions are going to be so extremely vital so that these communities are reached not just with immunization, but also other essential services, adopting highly integrated and efficient service delivery approaches. And that really means changing our mindsets at the global level, because there is no one size that's going to fit the needs of all countries and contexts. We are looking here at heterogeneity, a lot of regional variability, country-specific variability, also a lot of disparity within countries at subnational level. So really, the ability of multilateral institutions to stay flexible and actually respond to very different, highly contextualized needs of countries is really going to hold the key. And that would involve forging partnerships with community-based organizations and local partners, something that we haven't done that well in the past. So far as Gavi is concerned, our new strategy is so laser focused on equity, and that is why in a historic decision, the Gavi Alliance Board recently approved $500 million as dedicated additional funding to support Gavi countries so that they can identify and then address various equity barriers and reach zero-dose children. It is heartening that the recently released second progress report of the SDG 3 Global Action Plan recognizes zero-dose children, and Balaji just highlighted that as a marker of not just deprivation of vaccines, but as a marker of communities facing multiple deprivations, and therefore recognizes that reaching zero-dose children would be a core part of our approach towards equitable and resilient recovery from the pandemic. I would really urge that the global community must stand united around equity agenda, must speak in one voice, and really seize this opportunity to support countries in shaping their COVID response as a means to achieve social justice. We know that there are several people and households in every country where the space is so cramped that people are unable to maintain any kind of social or physical distancing or observe any kind of COVID-appropriate behavior. Adults in these vulnerable households receive priority protection of COVID-19 vaccines, and children in those households need protection of routine immunization as well as other services. So what better way to do resilient recovery than to focus on zero-dose children and communities that there's such a compelling reminder of. And with this, I turn it back to you, Elizabeth.
Thank you so much, Anuradha. And I think very much hear your call and many of the speakers already about, as deep as this crisis is, how much it's also an opportunity to surge in with efforts to remedy quite a number of issues that come to roost in the health of children and families. So thank you so much. I want to turn the floor finally to Dr. Justin Kunin from ACON and from the middle of the night. Dr. Kunin, the floor is yours.
Thank you very much, Elizabeth. Thank you, Excellencies. The virus doesn't stop at midnight, so it's a pleasure to be here. We're obviously in an acute moment right now, but I think we shouldn't forget that the commitment the world made to health in the SDGs and in the UHC high-level meeting political declaration predated the pandemic, and it'll continue on to 2030 and beyond. We're in a marathon, not a sprint. What we want is UHC and global health security, and how we get there is through health system strengthening, through equitable and good quality primary health care, as we've heard from others, through sustainable financing, strengthening country data systems, through improving community and civil society engagement, a strong gender equal health workforce. Thanks for those comments in the Q&A, Kate Dodson. And there's a focus on all of these within the accelerators of the Global Action Plan. And I think multilaterals can really support countries as they respond to the immediate crisis by keeping a long-term focus on the pillars of health system strengthening, which prepare them better for the future and for the next crisis. And it's not just the multilateral system which needs to do this. This also needs to happen among the global health partnerships driving the SDG 3 advocacy agenda. And so it's my pleasure today to announce the formation of a new coalition of partnerships for universal health coverage and global health, which will unite our advocacy and our accountability efforts with a focus on coordinating follow-up actions from previous high-level meetings, on preparing for future high-level meetings, and on strengthening accountability mechanisms like the high-level political forum. The founding members of this coalition are UHC 2030, PMNCH, UNAIDS, the NCD Alliance and the WHO Global NCD Platform, Stop TB Partnership, and the RBM Partnership to End Malaria, and we're really looking forward to joining forces. We'll be saying more at the official HLPF session on SDG 3 and related goals on the 8th of July, so please do join us there. And I'd also like to highlight another collaboration, this one between UHC 2030, PMNCH, GFF, Gavi, and the Global Fund, and that is a new country support toolkit on health budget, literacy advocacy, and accountability for UHC. And I understand this is being rolled out through a collaboration under the GAP Financing Accelerator. Health budget literacy is critical for civil society and other stakeholders to influence decision-making processes around UHC, and this toolkit helps design training and capacity building workshops at the country level. So please contact us if you'd like to learn more. I want to end on a related note with an appeal both to the multilateral system and to member states that if we're really to reach the furthest behind, true collaboration must include civil society and communities through social participation in policy making. That's our firm intention in this new coalition, as it is within the Global Action Plan through the Civil Society Accelerator, but we must do more than we're doing now. As many of the speakers today have said, ultimately it's only by breaking out of both our sectoral and our health issue specific silos that we're going to get back on track with the SDGs. Thank you so much.
Thank you so much, Justin, and thank you to you all. We've heard what countries have learned and what they need out of this crisis. We've heard about the role and tools of WHO and its partners, and we now have a very brief time for questions from attendees. Time is criminally short. So what I propose is that I'll read out the main questions. We consolidated these into 4 themes and come back to the panelists for just 1 minute of closing reflections each and ask you to respond to whichever one of these you choose, or to pass if you prefer to do that. And I'll go in reverse order when I come to you. So let me read out the 4 key themes that we heard from the floor. So question 1 is about intersectionality. So we've heard we know from the current pandemic how much intersectoral policies matter, how health can affect education, gender equality, income security, and more. And of course, the converse can be true. Can GAP partners provide specific examples on how they've pivoted guidance and support to countries to reflect lessons learned over the past year and a half? Question 2. Several speakers highlighted data gaps that impede a full picture of progress. What's being done by GAP partners to support countries to enhance the quality and completeness of data, as well as how to use data to drive decision-making? Are there some models or examples here? Question 3. Some populations, especially the Pacific Islands, will not be covered with COVID-19 immunizations by COVAX or bilateral deals. How can regional efforts to diversify vaccine manufacturing be best supported? And what role does the World Health Organization, UN, World Bank, and others have in such an effort? And finally, question 4, the already taxed health workforce around the world has shown tireless commitment to addressing the pandemic while also maintaining essential health services. There's no doubt that primary health care is the most important foundation to achieve UHC. What more can be done to urgently bolster the capacities, needs, and compensation of the health workforce, over 70% female and radically undercompensated, so that our efforts to advance PHC can put the health workforce needs at the center? So 4 very meaty questions. I'm going to go to each of you in reverse order for just a minute each. Don't feel compelled to answer all of them, but if you can pick up a theme from one, that would be wonderful. And then we'll have, I hope, time to go to Dr. Singer for our very final reflection of the day. So Dr. Coonan, Justin.
Thanks very much, Elizabeth. Well, I might pick up on the brief comment I made around the healthcare workforce, and just to highlight the work that is being done in the Gender Equal Health and Care Workforce Initiative that is jointly run by the World Health Organization and the government of France. And that is something that UHC20 is firmly behind, as we are with the Gender Equality Forum recently hosted by UN Women. It's critical not just that we bolster a health workforce, but we do it in a way that is gender equitable, because as Kate pointed out in the question, the health workforce is 70% female, but only 25% of leadership positions are held by female. That has to change, and the Gender Equal Health and Care Workforce Initiative is a great way to do that. I think we'll stop.
Well, thank you, and a model of brevity. Dr. Balaji, next to you.
Thank you. I'll try and respond to the multisectorality, which I did mention very briefly. In the WASH sector, in the education sector, there are frontline workers who have to do resume, for example, primary education, equip communities to undertake safe hygiene practices to prevent infections and further spread of the vaccine. There is joint guidance from WHO and UNICEF and other agencies to help countries implement areas for strengthening the frontline workers, not just of the health system, but across multiple sectors, so that we can help communities build resiliency around some of these sectors and resuming some of these services, not just the essential public health functions, but also essential social sector functions such as education. Thank you.
Thank you so much. Brigitte, Ms. Edson, to you next.
Thank you so much. I will take a variation of one of the questions on the health workers. We have both health staff, but also volunteers that are working at the front line, and to them we have a duty to protect and ensure their safety. And I think that's something that we have been working with for a long time, but that became very important during the times of COVID, where some of the volunteers were not even safeguarded by an insurance, when a health insurance, when something happened to them if they got COVID. So we had a very precarious situation, I would say, and have had to work with that during the time of COVID. And then I just wanted on the vaccine to say that in the Red Cross and Crescent movement in the IFRC, we are trying to do advocacy around the countries that have a surplus of vaccines and try to help these vaccines being transmitted to countries that are in greater need of them before the expiry date is closed. I think that's another contribution to how we can support. Thank you.
Thank you so much. Anuradha Gupta. your final reflection.
So, first of all, data is very important for us at Gavi, and therefore we have scaled up our investments in data for the last 5 years, including in several innovations, digital innovations, for example, geospatial mapping, triangulation of data sources, to really dig deep and understand, as I was saying in my previous remarks, really the subnational differences and zooming in on those communities and habitations which suffer from acute inequities. So lots of exciting investment, and therefore based on all that data mining, now we have developed a much better understanding of zero-dose children and communities, a concept that we pioneered because we realized in the past DTP3 was really the tracer indicator or proxy indicator for access of immunization. And there are about 14 million children in Gavi-supported countries who did not receive the third dose of DTP. But as we started to look at data more seriously, we realized 2/3 of those children, about 11 million children, do not receive even a single dose of DTP. And that is how we came up with the concept of zero dose. And as then we gathered and dissected more and more data, we realized that there is this powerful concept of compounded vulnerabilities and multiple deprivations, because these communities, its immunization is just one of the several services that they're deprived of. And that's why a new guidance now, all our funding guidance emphasizes integration. For example, on HPV vaccination, we are saying HPV vaccination is a wonderful opportunity to focus light on other things like menstrual hygiene, for example, or other adults and health issues. But also when disease-specific initiatives are being rolled out, be it polio or measles or other initiatives or campaigns, then we must try and co-deliver as many services as possible, because every contact that we establish with marginalized communities must be maximized. And so a lot of active support for integration agenda, not just within health sector or health enhancing sectors, but also other complementary sectors such as education, nutrition, sanitation, water. And at the global level, we have now forged a new partnership through new memorandum of understanding, but really global level is just one part and the beginning of an effort which really has to come to life at the country level, and more importantly at the community level.
Thank you so much. Dr. Kluge, if you're still with us.
Dr. Kruger had to join another meeting.
All right, then we'll go to Dr. Al-Mandari, and he may have the last word if he's still with us.
Sure, my pleasure, Elizabeth. And if you don't mind, I'd like to give remarks on the first question, and then I resume the third question on vaccination. For the first question, in fact, we have been working very closely with the 12 or maybe 14 signatories of the GAP. As I have mentioned, we have created our Health Alliance, Organic Health Alliance, and we have started, in fact, working on the ground, particularly in country conflicts and instabilities, because I feel that is the area in which we can implement solidarity between different UN agencies and partners and donors. So we have started doing a lot of work on the ground, programs, projects shared together jointly in a very collaborative, integrated manner, as well as we have introduced, recently, whatever missions that we take, technical missions we take to countries, we do it in close collaboration with other UN agencies. And we have had a mission to Pakistan in which all 12 signatories have participated in that mission. It really helped us to identify the strengths and the opportunities of improvement from a very holistic perspective. Another remark on vaccine production. In fact, as you know, we have been trying and working closely with the ministers of health in some countries here in the region to transfer the technology and build on the old history of some countries in the region here when it comes into vaccine production. And as you all know, that COVID-19 vaccine is really, and COVAX, facing global shortage when it comes into quantity. So therefore, we have already started that discussion last year, and I'm really proud to say that Egypt has already started this week and last week producing vaccines through strong collaboration and agreements with some other countries outside the region. So this is a very promising, encouraging sign for us. Thank you very much. Back to you.
You're muted, Elizabeth.
You would think at this point I would know how to unmute myself, but thank you for reminding me. Well, thank you to all of our panelists. We could have had so much more time with you today, but we want to thank you for the time you did give us. Very rich discussion.
Thank you. By the way, sorry, thank you so much. I just wanted, I interjected to say thank you so much, especially Minister Ahmed. You know, the whole time just impressed, so thank you. And to all colleagues also, I made it to the end. Just wanted to say thank you so much.
Thank you. We're being zoomed on by Dr. Tedros. That is a great honor. Thank you, Dr. Tedros.
Thank you so much.
Our very final words for today are from your special advisor, Dr. Peter Singer, who is also the chair of the SDG 3 Global Action Plan Focal Points Group. Peter, you've waited patiently for your final remarks, and we're thrilled to hear from you now.
Elizabeth, thank you so much for your wonderful moderation, and I'll be extraordinarily brief because of the time. First, I'd like to echo Dr. Tedros' thanks to the honorable ministers, regional directors, and all of our GAP partners. And secondly, just assure you of our full support in terms of working together in the multilateral system across 13 agencies in support of countries, because that's where the fight against COVID happens, and that ain't over till it's over. And we're facing terrible vaccine equity / injustice issues, even at the moment. And then secondly, the issue of the equitable and resilient recovery and how we can move together forward. To echo Dr. Tedros's comments. And in closing, I'll just remind us of what Dr. Tedros said at the launch of GAP, which is collaboration is the pathway, impact is the destination. And that's what we're all interested in, and we'll only be able to do that together. So please call upon us. You have our full support in GAP for the multilateral system to work together. And thank you so much, Your Excellencies, regional directors, partners, and all others on this call. Thank you, Elizabeth. Back to you.
Well, thank you, Peter. There couldn't be any better closing words. So all that is left for me to do is to thank everyone. Thank you once again to all of our panelists, to our eminent ministerial speakers, to the government of Indonesia for co-sponsoring, and Dr. Tedros, as ever, to you and your entire team for your incredible dedication to good health for all. We depend on it every day. We're grateful for it every day, and we thank you for it every day. So thanks again to all of you for joining and providing your valuable perspectives. Let's keep the conversation going, and I wish everyone a very safe and healthy day.
Thank you.
Thank you. All the best.
Assalam.
Bye.
Thank you.